Welcome everyone. Today we are going to dive deep into a topic that affects millions of people worldwide: blood sugar. Blood sugar, also known as glucose, is the primary source of energy for our body's cells. It's like fuel for your body's engine, powering everything from your brain to your muscles. But just like the fuel in your car, you need the right amount, not too much, not too little. When we eat, our body breaks down carbohydrates into glucose, which then enters our bloodstream. This triggers the pancreas to release insulin, a hormone that enables cells to absorb glucose and use it for energy. Now let's talk about the difference between normal and high blood sugar levels. A healthy person's blood sugar levels typically range from 70 to 100 milligrams per deciliter after fasting, and less than 140 milligrams per deciliter 2 hours after meals. On the other hand, high blood sugar or hyperglycemia occurs when the body can't effectively transport sugar from the blood into cells. This could be because the body doesn't produce enough insulin, or the cells become resistant to insulin's effects. Persistent high blood sugar levels pose serious health risks. It's like driving your car with the gas pedal down all the time. It puts a strain on the engine and can cause serious damage over time. Constantly high blood sugar can lead to a host of health issues, including diabetes, a condition that affects more than 400 million people worldwide. It also increases the risk of heart disease and stroke, two of the leading causes of death globally. With the seriousness of high blood sugar levels in mind, it becomes clear why maintaining a healthy balance is so important. It's not just about managing a number, it's about taking care of your overall health and well-being. So stick around as we explore ways to lower high blood sugar and keep it in check. Stay tuned. Now that we understand why blood sugar is so important, let's learn how to identify when it's too high. High blood sugar, or hyperglycemia, doesn't always wave a red flag to alert you. It often sneaks in subtly, manifesting in common symptoms that you might dismiss as just another busy day or a result of aging, but understanding these symptoms can be a vital part of your health journey. One of the most common signs of high blood sugar is frequent urination. If you find yourself needing to visit the restroom more often than usual, it might be your body's way of trying to flush out excess sugar. Another symptom is an increased thirst. When your body is trying to get rid of sugar through urination, it can leave you feeling dehydrated, making you reach for that water bottle more often. Fatigue is another telltale sign. High blood sugar forces your body to work overtime to process the excess sugar, leaving you feeling drained and tired. Blurred vision can also be a symptom of high blood sugar. Excess sugar can cause the lens in your eyes to swell, affecting your ability to see clearly. Lastly, if you notice that your cuts and sores are taking longer than usual to heal, it could be a sign of high blood sugar. Elevated sugar levels can affect your blood circulation and slow down the healing process. While these symptoms can hint at high blood sugar, they are not definitive proof. Regular blood sugar testing is crucial, especially for those at risk. Conditions like diabetes, obesity, or a family history of these can put you in the high-risk category. Regular testing can help you keep a close eye on your blood sugar levels and take necessary action if they start to climb. Remember, high blood sugar doesn't always shout. Sometimes, it whispers. These whispers, these symptoms, are your body's way of telling you that something isn't right. Recognizing these symptoms can be the first step to managing your blood sugar levels effectively. So, keep an eye out for these signs, and remember to listen to your body. It's always trying to tell you something. Now, let's talk about the first line of defense against high blood sugar: lifestyle changes. These changes are your daily habits, the choices you make in what you eat, how you move, and how you rest. A balanced diet is crucial in managing high blood sugar. You'll want to focus on foods that are high in fiber, low in sugar, and rich in lean proteins. Fiber, for instance, slows the absorption of sugar into your bloodstream and prevents spikes in blood glucose. Foods like whole grains, fruits, vegetables, and legumes are excellent sources of fiber. Lean proteins, on the other hand, help you feel full longer, reducing the likelihood of overeating. They also have minimal effect on blood sugar levels. Think of foods like skinless chicken, turkey, fish, eggs, tofu, and low-fat dairy products. But it's not just about what you eat, it's also about what you should avoid. Foods high in sugar, such as sodas, candy, and desserts, can cause your blood sugar to skyrocket. So can simple carbohydrates found in white bread, pasta, and rice. Instead, opt for whole grain versions of these foods. Next, let's move on to physical activity. Regular exercise can help lower your blood sugar by increasing insulin sensitivity. This means your body can better use the insulin it produces or gets from medication. The type of physical activity you choose can vary, It could be something as simple as a brisk walk, a bike ride, or a swim. It could also be something more structured, like a gym workout, yoga session, or a dance class. The key is consistency. Aim for about 30 minutes of moderate intensity exercise most days of the week. And finally, we come to sleep. Adequate sleep is often overlooked but is vital in maintaining stable blood sugar levels. When you're sleep deprived, your body's insulin sensitivity can decrease, leading to higher blood sugar levels. Try to create a sleep-friendly environment and stick to a regular sleep schedule. Aim for 7 to 9 hours of sleep each night. Incorporating these changes into your lifestyle might seem challenging at first, but remember, you don't have to do everything all at once. Start small, perhaps by adding more fiber to your diet or by taking a short walk each day. Gradually, these small changes can add up to a big difference in your blood sugar levels. Also, it's important to note that everyone's body responds differently. What works for one person may not work for another. Therefore, it's always best to consult with a healthcare professional before making significant lifestyle changes. Remember, these lifestyle changes can be a powerful tool in keeping your blood sugar levels in check. So take control of your health today by making smart choices about your diet, physical activity, and sleep. Sometimes, lifestyle changes alone aren't enough. That's where medication comes in. In our journey of understanding how to lower high blood sugar, let's take a moment to discuss the role of medication and medical consultation. The power of medication in managing high blood sugar is indeed significant. There are various types of medications available that can help lower your blood sugar levels. Some work by stimulating your pancreas to produce more insulin, while others reduce the amount of glucose produced by your liver. Yet others slow down the digestion of starches in your foods or improve insulin sensitivity in your body. It's like having an arsenal of tools at your disposal, each with its unique way of helping you control your blood sugar. But here's the catch. Medication is not a one-size-fits-all solution. What works for one person might not work for another. Each individual's body responds differently to medication, and various factors like age, overall health status, and the severity of your high blood sugar condition can influence the effectiveness of a particular medication. That's why it's crucial to seek medical advice before starting any medication. Your healthcare provider can guide you on the right medication, its correct dosage, and the timing of its intake based on your unique needs. They can also help you understand the potential side effects and how to manage them. Now let's talk about regular checkups and monitoring. Once you start on medication, it doesn't mean you can sit back and relax. Regular checkups are vital to ensure the medication is working as it should, and to adjust dosage if necessary. Regular monitoring of your blood sugar levels also helps you and your healthcare provider stay on top of your condition. Remember, while medication can be a powerful ally in your fight against high blood sugar, it's not a magic bullet. It works best when combined with healthy lifestyle changes, and it certainly doesn't eliminate the need for regular medical consultation and monitoring. Never underestimate the power of medical advice and intervention when it comes to managing your blood sugar. It's your health, your life. Make it count. Stress can be a silent trigger for high blood sugar. Let's talk about managing it. Stress can be a sneaky culprit when it comes to high blood sugar levels. When we're under stress, our bodies respond by releasing hormones that increase blood sugar levels. This is a natural response designed to give us the energy to deal with the perceived threat. But in today's world, stress isn't always about physical danger. It can come from work pressures, family responsibilities, financial worries, and even traffic jams. And when our bodies keep responding to this kind of stress by pumping out those blood sugar-raising hormones, it can lead to problems. So how can we manage stress and help maintain healthier blood sugar levels? First, let's talk about mindfulness. This is a practice of focusing your attention on the present moment without judgment. It's about noticing your thoughts, feelings, and sensations without getting caught up in them. Mindfulness can help you respond to stress in a healthier way, rather than reacting in ways that can raise your blood sugar. You can practice mindfulness in many ways, such as through meditation, mindful walking, or simply taking a few moments to breathe and focus on your senses. Which brings us to the next strategy: deep breathing exercises. When you're feeling stressed, your breathing can become shallow and rapid. But by consciously slowing your breathing and taking deep, full breaths, you can help calm your nervous system and reduce the stress response. You can do this anytime, anywhere. Just close your eyes, inhale deeply through your nose, hold for a count of 5, then exhale slowly through your mouth. Repeat this for a few minutes, and you'll likely feel a sense of calm washing over you. And finally, consider incorporating yoga into your routine. Yoga combines physical postures, breathing exercises, and meditation to promote physical and mental well-being. It's been shown to reduce stress and anxiety, and it may also help with blood sugar control. Remember, a calm mind can lead to a healthier body. So, let's make stress management a key part of our strategy for lowering high blood sugar. Constant vigilance is key when it comes to managing blood sugar. Let's delve into the why and how of regular blood sugar monitoring. You see, high blood sugar doesn't always come with a warning label. It can sneak up on you. That's why it's vital to keep an eye on your blood sugar levels regularly. It's like having a conversation with your body, understanding what it's going through and responding to its needs. Now you may wonder, how do I monitor my blood sugar? Well, that's where a glucose meter comes in handy. This little device is a lifesaver, literally. It tells you your blood sugar levels in less than a minute. All it takes is a small drop of your blood, usually from your fingertip. Here's a simplified step-by-step guide on how to use it. First, wash your hands thoroughly. Then, insert a test strip into the meter. Prick your fingertip with the lancing device provided. Apply the drop of blood to the test strip. And voila! Your blood sugar reading appears on the meter's display. But monitoring your blood sugar doesn't end there. It's equally crucial to keep a record of your readings. This record is like a diary of your blood sugar levels. It can show you patterns and trends, helping you understand how factors like food, physical activity, stress, and medication affect your blood sugar. It also provides invaluable information to your healthcare team, allowing them to tailor your treatment plan better. Remember, consistency is key in monitoring. It's not a one-time event, but a regular practice. You and your healthcare team can decide the frequency that suits your needs best. Think of regular blood sugar monitoring as your compass. It guides you, showing you when you're on the right path and when you need to make a detour. It empowers you to take control of your health, to make informed decisions, and to live a healthier, happier life. Regular monitoring can help you stay on top of your blood sugar and make necessary adjustments. Let's recap what we've learned today about managing high blood sugar. We started our journey by understanding what blood sugar is. It's the main source of energy for our body's cells, and we need it to keep us going. But too much of it can lead to health problems. We learned that high blood sugar, also known as hyperglycemia, isn't a condition to be taken lightly. It can lead to serious health complications like heart disease, kidney disease, and nerve damage. We then moved on to identifying high blood sugar. While it may not always show clear symptoms, we discussed some common signs to watch out for, such as frequent urination, increased thirst, and unexplained weight loss. Remember, early detection can make a significant difference. Then we talked about lifestyle changes. These are crucial to managing high blood sugar. We emphasized the importance of a balanced diet, regular physical activity, and maintaining a healthy weight. These factors can all play a big role in regulating your blood sugar levels. Next, we explored the role of medication and medical consultations. We stressed the importance of working closely with your healthcare provider to create a personalized treatment plan. Whether it's oral medication, insulin injections, or something else, the right treatment can help manage your blood sugar effectively. Stress management also came into play. We discussed how stress can affect your blood sugar levels, and shared some techniques to help you relax and manage stress in your daily life. We rounded up our discussion with the importance of regular monitoring. Keeping a close eye on your blood sugar levels is key. Regular checks can help identify any fluctuations and make necessary adjustments to your lifestyle or medication. Remember, managing your blood sugar is a journey, not a destination. Stay vigilant, stay healthy, and don't forget to subscribe to our channel for more health tips and advice.